Good day everyone, I am Yddann Dapitan and I am going to inform you about common communicable diseases, preventions, and tips. The two examples of common communicable diseases that we are going to talk about today are chickenpox and tuberculosis, that is also known as TB. But first, let us know what is common communicable diseases means. Common communicable diseases spread from one person to another. How are you? Or from an animal to a person. The spread often happens via airborne viruses or bacteria, but also through blood or other bodily fluid. Now we know what the common communicable diseases means. And now we will continue to talk about the two examples of common communicable diseases. Chickenpox is a highly contagious disease caused by the varicella zoster virus or VZV. It can cause an itchy, blister-like rash. The rash first appears on the chest, back, and face, and then spreads over the entire body, causing between 250 and 500 itchy blisters. Chickenpox can be serious, especially in babies, adolescents, adults, pregnant women, and people with a weakened immune system. The best way to prevent chickenpox is to get the chickenpox vaccine. The virus spreads easily from people with chickenpox to others who have never had the disease or never been vaccinated. The virus spreads mainly through close contact with someone who has chickenpox. The varicella zoster virus also causes shingles. Chickenpox can be spread from people with shingles to others who have never had chickenpox or received the chickenpox vaccine. This can happen through close contact with someone who has shingles. A person with chickenpox is contagious beginning 1 to 2 days before rash onset until all the chickenpox lesions have crusted or scabbed. Vaccinated people who get chickenpox may develop lesions that do not cross. These people are considered contagious until no new lesions have appeared for 24 hours. It takes about 2 weeks from 10 to 21 days after exposure to a person with chickenpox or shingles for someone to develop chickenpox. If a vaccinated person gets the disease, they can still spread it to others. For most people, getting chickenpox once provides immunity for life. However, for a few people, it is possible to get chickenpox more than once, although this is not common. The best way to prevent chickenpox is to get the chickenpox vaccine. Everyone, including children, adolescents, and adults, should get 2 doses of chickenpox vaccine. If they have never had chickenpox or were never vaccinated. Chickenpox vaccine is very safe and effective at preventing the disease. Most people who get the vaccine will not get chickenpox. If a vaccinated person does get chickenpox, the symptoms are usually milder with fewer or no blisters. They may have just red spots and mild or no fever. The chickenpox vaccine prevents almost all cases of severe illness. Tuberculosis or TB is caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but TB bacteria can attack any part of the body, such as the kidney, spine, and brain. Not everyone infected with TB bacteria becomes sick. As a result, two TB-related conditions exist: latent TB infection or LTBI and TB disease. If not treated properly, TB disease can be fatal. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs or pulmonary TB. TB disease in the lungs may cause symptoms such as a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, phlegm from deep inside the lungs. Other symptoms of TB disease are weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Symptoms of TB disease in other parts of the body depend on the area affected. People who have latent TB infections do not feel sick, do not have any symptoms, and cannot spread TB to others. If you have active TB disease, you must get treated right away. This might involve taking a number of medications for 6 to 12 months. It is important to take all of your meds as they are prescribed the entire time, even if you feel better. If not, you can get sick again. If you have TB germs in your body but they haven't become active, you have what doctors call latent TB. You can spread the disease to others, but your doctor may still recommend that you take medications to keep the germs from becoming active. Follow these other tips to help prevent others from getting TB during your first few weeks of treatment or until your doctor says you are no longer contagious. Take all of your medicines as they are prescribed until your doctor takes you off them. Keep all your doctor appointments. Always cover your mouth with a tissue when you cough or sneeze. Seal the tissue in a plastic bag and then throw it away. Wash your hands after coughing or sneezing. Don't visit other people and don't invite them to visit you. Stay home from work, school, or other public places. Use a fan or open windows to move around fresh air. Don't use public transportation. Still, healthcare workers who spend a lot of time around TB patients might benefit from the vaccine. Doctors make that decision based on the healthcare worker and their unique circumstances. I hope you have learned to my topics about common communicable diseases are and what are chickenpox and tuberculosis preventions. Thank you for watching, and remember, health is wealth.